Start if you're ready.
Okay. Welcome everyone, and welcome to our webinar on community visions, addressing gender-based violence in the South Asian diaspora through creative practice and policy. So we are really here and very excited to have everyone with us this morning. My name is Cecile Noel, and I am the Commissioner for the Mayor's Office, the New York City Mayor's Office to End Domestic and Gender-Based Violence. And to start things off, I would like to thank Sakhi for South Asian Women for hosting today's important dialogue about domestic and gender-based violence. I hope you all know that this is Domestic Violence Awareness Month. And it is in this month that we pay particular attention to highlighting just the issues that we know that so many in our community face around domestic violence, domestic and gender-based violence. I am honored to be here with panelists and colleagues from the Arab American Family Support Center, the Jahajee Sisters, Manavi, Safe Horizon, the Queen's Women's March, and Sakhi for South Asian Women. Thank you all for inspiring us daily with your steadfast commitment to survivors. And to today's moderator, my deepest appreciation goes to my colleague, Susan Jacobs, the Executive Director of the Queen's Family Justice Center for facilitating this important discussion. And finally, thank you to those who have joined us for this important event. I am thrilled. We have come together to lend one another our combined expertise and thoughts in the fight to end domestic and gender-based violence. Moreover, I want to point out that virtual gatherings like these are vital in our efforts for survivors, especially during this age of social distancing. We all know the effects of social distancing, including how it can create a deep, deep sense of isolation for some. Imagine what survivors are up against during this health crisis and the overwhelming sense of isolation that they are experiencing. Remember the special role you play in the lives of survivors. You may be able to offer them a safe space, a way to voice their stress and frustrations, their fears, all as they endure during this COVID-19 health crisis. The small amount of time that you will spend with us today may help change the life of a survivor for the better. And we are proud to have you by our side in this fight against violence. COVID-19 puts into sharp focus the vulnerabilities that many people in our city face every day, especially gender-based violence survivors. And it highlights the barriers and challenges that we know keep people from seeking help and finding safety. It's really important to remember that the city is here for survivors during this crisis and beyond, and will continue to work to identify best practices and innovate approaches to enhance its services. Survivors need us now more than ever during these extraordinary times, and our top priority remains to ensure the continuity of services and an unwavering support. Together, we can tell survivors that they are not alone, that they are never alone, and that help is here for them. We hope you will continue to join us and to help raise awareness for Domestic Violence Awareness Month over the next few days. You can share our NYC Hope website, which is www.nyc.gov/NYC Hope, with your loved ones, friends, colleagues, to learn about the signs of domestic and gender-based violence. We will put that information into the chat so everyone can get the website. Or if you know someone who needs help, you can share the New York City 24-hour domestic violence hotline number, 1-800-621-HOPE or 1-800-621-4673. for assistance with immediate safety planning, shelter assistance, and community resources. I would like to conclude my remarks by introducing you to a very special guest, the First Lady of New York City, Chirlane McCray. I have the honor of working with the First Lady. Not only have I seen her transform the role of First Lady, but I have also witnessed how she has moved to eradicate the stigma attached to individuals with mental health issues. She has also demonstrated an unwavering commitment to survivors of domestic and gender-based violence. The First Lady was instrumental in the decision to expand the scope and mission of the Mayor's Office to combat domestic violence to the now Mayor's Office to End Domestic and Gender-Based Violence. And this expansion helped to make New York City a national leader in the response to gender-based violence. The First Lady understands the commitment and intersection of gender-based violence issues across race, gender identity, and socioeconomic status. Her compassion and leadership in this area is outstanding. And it gives me great pleasure that she will spend some time with us this morning. Please welcome the First Lady of New York City, Miss Chirlane McCray.
Good morning, and thank you for inviting me to join all of you. Thank you, Commissioner Noel, for your kind introduction, your warm introduction, and all you have done to protect our families and our children over these last decades. I thank all the panelists we'll hear from shortly. Thank you, Kavita, Reshmi, Veda, Vidula, and everyone at Sakhi for South Asian Women. Our city has counted on you for 31 years now, and never has that been more clear than the past 6 months. From your food justice program to ESL classes to skills training that helps survivors find work, you are caring for the whole person, and you're going above and beyond to protect New Yorkers and give them hope. Everyone at the Queens Family Justice Center is truly grateful for your support and partnership, and I am grateful too. I'm a hugger, and I wish I could be with you all in person today, but I'm gonna send you all a virtual hug, and I hope you feel the warmth and the positivity of that touch virtually. I wanna talk today about a simple phrase. You're safe at home. How many times have we heard that over the past months? From doctors, politicians, epidemiologists, we know what they mean. We know it's true, that it's better to be away from crowds, away from the COVID-19 virus, but that phrase doesn't always sit right. Don't you agree? Because buried in that phrase is an assumption, and it's one that everyone in this room knows is just not true. Home is still not a safe place for so many New Yorkers. And we know especially how painful that reality is in this community. For South Asian and Indo-Caribbean survivors, getting access to support and care is complicated. Breaking a cycle of violence isn't only about standing up to an abuser, it can mean standing up to long-held assumptions and traditions. It can mean leaving everything familiar to you behind. It can require strength on a whole nother level. But I keep coming back to a beautiful phrase a survivor said to me recently. If you can't be strong, be brave. If you can't be strong, be brave. I've talked to a survivor who used the word red in phone calls with her best friend when she and her children were in trouble. Another who had a special knock on the wall with her neighbor to let her know things had gone from bad to worse. And another who would remove a photo from the view of her window to signal that she was in trouble. As we come together today to reflect on our work, those are the moments I think about. What inspired them was knowing that help was possible, that someone saw their pain and could help them change their lives. We need to bring that same message to every survivor and every person suffering. In this crisis, we see domestic violence rising, and a pandemic that has made it harder to provide traditional means of support. And we see survivors whose struggles are compounding, dealing not only with domestic violence, but lost jobs, anxiety, depression, and questions about how they'll put food on the table. That's why leaders like Commissioner Noel and everyone at GBV have worked around the clock, making sure survivors can still find the support they need. It's why we launched an emergency relief program that gives survivors more immediate access to safety, shelter, and financial stability. It's why we must let every person know that they can call 1-800-621-HOPE any time of day or night, or go to nyc.gov/NYCHope. And it's why we are so proud and grateful to have a partner like Sakhi. Again, I'm deeply grateful for the work that you do every day. Together, we have a simple mission: to let every survivor and every person suffering know there is always help and always hope. There is always hope and there is always help. Let's make home a safe place for every New Yorker. And now it's my great pleasure to introduce an extraordinary leader for our city. In her time as executive director, she has deepened Sakhi's reach, expanding into housing, food security, and mental health counseling. She understands that serving survivors means serving the whole person. And she's already changed the course of many lives in Queens and beyond, and she's committed to helping every survivor begin a better future. I'm delighted to introduce Executive Director Gabi Dabira.
Thank you to the First Lady of New York City for your powerful opening remarks and for the warm introduction. This conversation could not be possible without an army of folks, and I would be remiss if I did not highlight their generous contributions, including Grace Choi, Commissioner Cecile Noel, Jennifer DeCarli, and the Mayor's Office to End Domestic and Gender-Based Violence, Susan Jacob and the Queens Family Justice Center, and our panelists, Aminta, Tara, Bidhata, Navneet, Simone, and Vidula, and of course, my colleagues at Sakhi. Thank you for your collective efforts in today's production and for bringing this dialogue to our community. We come to this conversation to frame the issue of gender-based violence, address the effects of the pandemic, and discuss community solutions to the systemic problems that diminish our community's standards of living. As a unique set of organizations serving diverse populations, we have diverging experiences. But what holds true for all of us is that we have seen a marked rise of gender-based violence across our communities. We know that as the pandemic started to take into effect in New York City, crisis responders serving survivors were gearing up for a parallel public health crisis: the rise of domestic and sexual violence. At Sakhi, our team went remote on March 12th, and nearly immediately advocates who work with survivors began active safety planning to prepare for this uncertain period. We also saw an immediate decline in our helpline calls, which indicated to us that survivors were not in a safe space to make calls. Through those dark days of March and April, our role as crisis responders had never been more evident, as our team sustained its strength to continue seamlessly serving survivors. What grounded us in those difficult days, and what continues to ground us, now is a commitment to an imaginative process that will allow us to build unique solutions, particularly during this time of instability. At the heart of today's conversation is the collective commitment to building new solutions and imagining something greater. Thank you for joining us today. And now it is my pleasure to hand it over to our moderator for this conversation, Susan Jacob. Susan Jacob is a staff person for the Mayor's Office to End Domestic and Gender-Based Violence and is the Executive Director for the New York City Family Justice Center in Queens. She has been working at the QFJC in various administrative capacities since 2008. Prior to her position with the Mayor's Office, Susan worked with the HIV/AIDS field office in New York City, in India, and in New York City, excuse me. Susan worked on issues including prevention of mother-to-child HIV/AIDS transmission in Bombay and transitioning HIV-positive youth to healthy adulthood. Susan started her career at the Asian and Pacific Islander Coalition on HIV/AIDS, where she managed the Center for Disease Control funded HIV counseling, testing, and referral program, working with high-risk communities. Please join me in welcoming Susan.
Thank you so much, Kavitha, for that warm welcome. I would like to thank also the First Lady of New York City for being with us. It's such a great honor. Grace Choi, our amazing Commissioner Noel, our great leader, Jennifer DeCarli, and of course, Kavitha and her wonderful Sakhi staff, as well as all of you who are in the audience. While we cannot be in the same room right now, I know each and every one of you is also working for the betterment of our communities, and we hope you walk away with knowing about community resources and also feeling a sense of hopefulness. This discussion will be about approaches to addressing domestic and gender-based violence. We also will be talking about the importance of approaches needing to be inclusive, regardless of gender, sexuality, caste, class, race, creed, immigration status. So I am so happy to be introducing these outstanding panelists who are in the community during this very difficult time. And despite these barriers, they are working tirelessly to ensure the safety of survivors and finding creative, innovative solutions to very complicated issues. They are so accomplished, and it would take me days to go over their bio because it's so impressive. So forgive me, I'm going to do an abridged version of their bio so we can get to the questions. Our Vidula is our director, the director of programs, and she has been working full-time with Sakhi in 2016 after her experience as a volunteer in 2014. As an immigrant herself, she feels closely connected to Sakhi's work and passionate about helping constituents find their voice. Navneet, Bhalla, currently serves as the executive director of Manavi. Manavi is a New Jersey-based South Asian nonprofit organization dedicated to ending all forms of violence against South Asian survivors. Amintha Kilawan-Narine is the co-founder of South Queens Women's March. And Aminta is also an attorney and community activist based in Queens. Born to Guyanese parents, Aminta's passion for social justice manifests in various aspects of her life. Simone Jhingoor is the co-director of Jahajee Sisters. Simone is an artist, social entrepreneur, and embodied leadership coach who brings knowledge and expertise in program development, resource mobilization, organizational change. Tara Wadhwani is at Safe Horizon at the Queens Family Justice Center, and she is our case manager. And Bidhata is the anti-violence case manager for Arab American Family Support Center, and she's based in the Brooklyn Family Justice Center. So we're gonna get right to the discussion. Each panelist will have 3 minutes to answer. And I know if people are like me writing all the notes, please know that we will be sending out the deck to all the attendees. So you're gonna have all these fabulous resources, information about our panelists. So we are going to get to the first question. How do we leverage the existing resources and available services at hand as we press forward and imagine new pathways during these difficult times? And the first person, I'm going to throw it off to you, Bidhata, from Arab American Family Support Center.
Sure. Sure.
Thank you.
Thank you, Susan. Thank you so much for providing this platform to share our ideas. So without wasting your time, I would like to quickly jump into the answer. So I would like to answer by sharing the experience and the active role my agency, Arab American Family Support Center, has played, especially during the pandemic. So listening to the needs of our community members, updating our service provision to meet these needs is critical. Since the start of COVID-19, AFC has ramped up our emergency relief fund. As a result of the increased need for financial assistance in vulnerable low-income immigrant and refugee communities, given the devastating loss of jobs and lack of federal financial aid, the need of our fund has skyrocketed. As of September 2020, we have distributed a total of $263,136, impacting 499 families and 1,644 individuals. In response to the increase in domestic and gender-based violence, we launched a confidential hotline with extended weekday and weekend hours that community members can call from a safe space to get connected to resources and answer to questions or concerns, including but not limited to domestic and gender-based violence. Due to the social distancing directives, we also quickly adapted to virtual case management system to continue our work. We are incredibly thankful for our partnership with Mayor's Office and New York City Family Justice Center, which has allowed us to assist with order of protection and connect clients to free 18B court attorneys at Queens Family Justice Center. Our advocates are also able to refer clients to counseling, housing support, and for legal appointments, for immigration, and for family legal consultation. Thank you.
Great. Thank you so much for sharing about the Arab American Family Support Center Relief Fund. It's incredibly impressive, especially when there's limited resources and increased need. And also for sharing about our QFJC program with the 18B attorneys since the launch. When we started working remotely, it's incredible. Since June of 2020, 145 petitions have been filed, which just tells you the incredible need. So now I will turn it over to Vidula to share information about Sakhi for South Asian women. Vidula.
Thanks, Susan. And thank you, Bidhata. Thank you for sharing all the great work that's going on with Arab Americans. For the past 31 years, Sakhi has served the South Asian community in New York City. This is an immigrant community inhabited by people of color and who experience gender-based violence in widely different contexts. It's a maelstrom where racism, immigration, language barriers all come to a head. And for the diverse audience that we have today, I want to take a moment to point out that while Asians and South Asians might share similar experiences, South Asians generally don't identify with the broad label of Asian. Many South Asians don't feel comfortable using or know that they can use the services targeting Asians in New York City. And that is why all the organizations on the panel today have a critical void to fill. On that note, I'm excited to announce that earlier this year, Sakhi was able to further expand our services by establishing a presence in Queens. Being in the community we serve has been a long-standing need, and we're excited. We have a full team in the new location ready when the pandemic is behind us. Just thinking about how much has changed and how much growing we've had to do in this short period of time, I want to highlight a couple of things. Early in the pandemic, we launched a text helpline to supplement our phone helpline. It had become clear that survivors in lockdown were not going to be able to reach us by phone. And we've seen a fair amount of traffic on the text helpline. Our services like crisis intervention, safety planning have had to go virtual, much like other organizations. Now we have virtual legal clinics. We have multiple weekly group therapy sessions in different languages. Our economic empowerment team has, they've spent a disproportionate amount of their time navigating sort of the ever-changing landscape of social services, unemployment benefits. We've also seen a remarkable rise in identity theft, check fraud, and tax fraud cases. And unfortunately, our current legal system just has not evolved and developed robust policy around these issues. And our clients really feel the effects of that in tangible ways. The last thing I want to mention is our food justice program. What started off as a South Asian food pantry in our office for our food insecure clients has seamlessly transitioned into a food delivery program where we have delivered essential pantry items as well as fresh produce every week to over 150 families for the past 7 months. And so just seeing where we are now, it's clear, we need to remain alert, we need to adapt, and we need to reinvent how we can continue to meet the needs of our survivors. Thanks, Susan.
Thank you, Vidula. Thank you so much for sharing. The food justice program is remarkable, and the self-sufficiency programs are incredibly impressive. And I know I am most excited about Queens office opening up. So it's such a great resources in Queens. So thank you so much for sharing that information. And also the linguistically appropriate therapy, which can be challenging. So I'm so glad you were able to share all that information. And thank you, Vidula. So our next speaker will be Navneet from Manavi.
Thank you, First Lady, Commissioner, and Sakhi for facilitating this important conversation. So we all know that the epidemic of domestic violence transcends all racial, ethnic, and socioeconomic boundaries and impacts all communities. But we also know that communities of color have unique challenges and unique barriers, specifically now during COVID-19. Communities of color across the board have been disproportionately impacted by COVID-19, and they also have disproportionate experiences of domestic violence. As First Lady mentioned earlier, we all recognize that our survivors have intersecting identities based on race and gender, as well as ability, socioeconomic status, class, sexual orientation. So it's really important that when we have this conversation, we talk about it within the context of social justice and the racial equity lens to fully understand how their intersecting identities impact their ability to access services and resources. And so we are better able to tailor the services to their unique needs. At Manavi, we have been providing culturally specific and linguistically appropriate services for the past 35 years. We are based right here in New Jersey, and we have 2 offices in New Brunswick, as well as Patterson, where we serve the Bangladeshi community, which we realize and fully understand is one of the most vulnerable communities within the South Asian community. So one of the valuable services that we have been providing since 1997 is our transitional home called Ashiana. During COVID-19, we have stepped up to ensure that the survivors and the residents who live in Ashiana have been provided with all the services remotely, but also in person where needed. We provide culturally specific groceries. We have provided economic empowerment and support. We have also provided virtual support groups. So just like many of our sister agencies here today, I think we have all had to adapt and realize that our survivors have essentially been in quarantine with their abuser. So their challenges have been so much more during this period. And we have ensured that all our services have continued during the pandemic, but also ensured that we are tailoring our services to their needs. Also wanted to point out that I think one of the things that we've realized as an agency is that this is the time where it's so crucial for us to focus on coalition building and ensure that Manavi has certainly done our part in making sure that we cultivate relationships and partnerships at a local level with various agencies. On that note, I think my time is coming up, so I'll make sure just to point out that partnerships and coalition building is key to ensure that we provide services to most vulnerable communities.
Thank you so much, Navneet. I probably will have questions about the transitional homes. That's really exciting that you have that, especially because we have a lot of clients from New York City who are relocating to New Jersey. So it's fantastic to know about these services that you are offering. So thank you for that. I turn it over to Tara from Safe Horizon.
Thank you, Susan. So I really wanted to highlight some of the key existing resources that the Queens Family Justice Center has really been getting us through the past few challenging months. So the Queens Family Justice Center has, for some time before the pandemic, been assisting clients getting orders of protections on site at the Queens Family Justice Center. We have a partnership with Family Court that has been allowing us to do that for clients in an environment that is less intimidating and where the case manager is right there next to you the whole time. So that was really great. Of course, with the pandemic and courts going remote and our offices going remote as well, we really had to reimagine how we were working to assist clients to get orders of protections. We also saw an increase in the need for orders of protections with, increase in domestic violence generally. And yeah, so we saw an increase in that. So we actually started a partnership at the Queens Family Justice Center and Safe Horizon. We started a partnership with the Assigned Counsel Association, which I think Bidhata mentioned. We call it the 18B attorneys, who are actually able to assist clients with petitioning for orders of protections remotely. And that has been so vital for us as service providers to ensure that clients are able to access legal services right now, even with the courts going remote and with all these new challenges. It's just been really great to have attorneys been able to represent clients and assist clients. And this is even, great considering that normally survivors aren't represented their first court appearance, but with this new program, we're able to get them representation for their first appearance, which is really an important appearance because, that's kind of make it or break it, where the judge decides do you get the order or not. So that's just been a huge benefit for our clients to have. Another resource I wanted to highlight was our computer time program. So this is, the name's confusing a little, but it's actually a program where we have an intern who, when we were on site, he would spend time with the clients on site to provide whatever practical support that they needed. So that could include resume writing, job searching, apartment searching, whatever it is. And now with the pandemic, we've been able to expand what he's able to do with our clients, because a lot of, for example, applying for HRA benefits has become something that he's doing a lot of, since most of HRA's applications have transitioned online. So he's able to actually guide clients through the process of applying for cash assistance, food stamps, all the one-shot deal, right? So that's been huge to actually provide clients that practical support. So yeah, those are just a couple of programs that have really been essential these past few months and that we've been able to expand during the pandemic. And like I think everyone has mentioned that the Queens Family Justice Center has definitely been able to transition very smoothly to providing remote services with legal consultations, therapy. Everything that we had before has transitioned very smoothly, and we're still able to provide language interpretation services in basically any language you can imagine. So, so it's been, I'm pretty impressed with what we've been able to do.
Thank you so much, Tara. And I just want to give her, because I have the pleasure of working with Tara, who is such an amazing advocate for so many of our community constituents, clients who walk through these doors. So thank you so much for Tara for sharing all those programs. The Family Justice Center are very fantastic to have a on-site organizations like Safe Horizon and Arab American Family Support Center. And we understand of these partnerships and these new partnerships with these great panelists that are on that are on right now. And we're also thrilled. We're actually adding in new partners like Korean American Family Service Center. We have Restore NYC who will be joining us, Women's Prison Association of Queens, and Defenders are also on site. So, you know, as you can see, the Family Justice Center, we have these incredible partnerships. We understand, especially during this time, that we can't do this alone. So thank you so much, Tara, for sharing all that resources at the Family Justice Center. And thank you as well for all the work that you do for clients each and every single day. So now I am thrilled to, for our next speaker, Amintha Kilawan.
Thank you, Susan. So everyone can hear me?
Yes, we can
Great.
hear you.
Okay, so first I want to thank the First Lady and the Commissioner for gracing us with your attendance and your participation and your hearts this morning. To Susan, thank you for having the good vision, among others, to host this important conversation. To Sakhi for South Asian Women for making it happen. And to my fellow panelists, I'm truly honored to be speaking alongside all of you today and to hear how overlapping many of our approaches have been throughout this time. So just a little bit about South Queens Women's March and how we have shifted priorities. So we actually were founded in January of this year, and we're an all volunteer organization started, like I said, right before the pandemic, as a movement of local activists and advocates who had a vision to connect our community to resources and to build a movement on our streets through that very connection to celebrate the resilience of women, girls, and gender nonconforming people hyper locally in South Queens, in spite of the struggles that we face on a daily basis, including gender-based violence. But then the pandemic hit, and we had to become providers of those very resources as opposed to connectors of those resources. And we never imagined that that would be the case, or that the grueling work ahead of us would be what it is. But we embraced the needs of our community, many of us coming to the table with our own various advocacy and activist backgrounds, becoming social service providers. And I want to flag that in the South Asian and Indo-Caribbean community, I'll say, it's not easy to accept assistance, right? So our people, I think, have a cultural reticence towards accepting resources, but the need throughout this pandemic has been very clear, and people have been coming in droves for those resources, getting whatever that they can, however they can get it. So South Queens Women's March has stood up culturally responsive food pantries, like many of my fellow panelists, providing foods like dal and flour to make roti. And these food pantries are run by community for community, which incentivizes that trust for community members to actually be part of the food pantries. And we offer other essentials like period products and safe sex products, which are also important at this time. We've hosted wellness workshops, integrating various movements and dances inherent to the people of South Queens, like Bollywood and soca as examples, but also meditation and yoga for healing purposes. And we've delivered virtual healthy relationships workshops in partnership with entities like GBV and the Family Justice Center to promote healthy boundaries and healthy sexual relationships during this time when toxic relationships can really fester at all levels of intimacy in relationships. And for youth and community members, we've built out a robust mentorship program, knowing that it's going to be increasingly difficult to access employment opportunities, to access networking, and to really get on your own 2 feet, whether you have lost a job, whether you're furloughed, or whether you're looking for a job. And all of this ties into mobilizing survivors of violence as well. And so, like many of my fellow panelists have said, for an organization like ours, with such limited resources, coalition building is critical to maximizing what it is that we do have. So I'll say that for years, the Indo-Caribbean community organizations locally have talked about getting together to pool resources and our various expertise, and COVID really pushed us to do that. For all its difficulties and all of its disadvantages, it's moved us to get together and to really stand up, like I said, those culturally responsive food pantries. A shout out to my fellow panelist, Simone Jhingoor from Jahajee Sisters. We've been working together on a lot of these efforts. And so how do we fund these food pantries is another question, right? Because a lot of these, we're not food service providers. We weren't food pantries existing with governmental contracts before the pandemic, but we literally don't have the funding to do this, many of our organizations, but we're doing this as volunteers with big hearts. And we've leaned on community members and local businesses who have the means to support us financially, whether with actual money or with in-kind donations. Many people just stepped up saying, hey, we want to help. We want to help organizations at this time. Where can we put our money into mutual aid efforts or food pantries? And they've come to us wanting to do this. I'll say I previously hated asking people for money and for donations, but it became so easy given the need is so great. And we're asking for this for community members. Like I said, during the pandemic, we're seeing many survivors who've lost their income or feeling heightened financial strain. And what was previously mild forms of abuse has now become increased and more violent forms of abuse. For us, it hasn't been about always being the service provider, but also being the connector, the referral source, and leveraging existing governmental infrastructure. That means helping community members to apply for things like unemployment. It means finding out if a community member is eligible for SNAP or cash assistance or burial assistance if it comes to that. It means distributing materials from the Family Justice Center and from New York City Hope at all of our events, including pantries, where the economic insecurity and gender-based violence can meet. We know that there's a corollary there. It means shifting policy and governmental responses, right, and advocating for that. So, you know, in the beginning of the pandemic, there weren't necessarily many COVID hotline text messages from the 692-692 number, but now we see that those are happening on a periodic basis. We're seeing increases to visits to New York City Hope and accessing of those resources. Lots of social media campaigning around domestic violence as well. So these are infrastructures that we're developing, and it's our hope that we can get ahead of what is definitely going to be an increased incidence of gender-based violence in our community. That's probably going to be a tidal wave of more victims, more survivors, more perpetrators by creating these infrastructures.
Thank you so much, Amintha, for sharing all the incredible work that you're doing in South Queens, particularly in the Indo-Caribbean community. I mean, I know Amintha for a long time, and she's such a great connector, especially for those folks who don't know about the existing resources that are out there. And she works day and night to ensure that the community members know that there is help out there. So thank you so much, Amintha, for sharing that. And of course, next, Simone, pass it on to you.
Good morning, everyone. I'm so grateful to be on this panel with you all and to be sharing the space with so many powerhouses. So I'll just start by just sharing a little bit about Jahajee Sisters. So we're a small but mighty grassroots organization that was founded in 2007, and we're led by Indo-Caribbean survivors of gender-based violence. Our work aims to empower immigrant and working class women. So and I'll just go straight into the question. So once the shutdown went into effect in March, like many organizations, all of our programs went virtual. And we also transitioned into doing mutual aid work to meet the needs of our community. We expanded our emergency fund, which was set up for survivors of gender-based violence who were in crisis, to now include women who were being economically impacted by the pandemic. And these are women who are new immigrants to this country from Guyana and Trinidad. Most of them have only been here in New York City for about 2 to 5 years. Many are undocumented and are low-wage workers. They're nannies, they're cleaners, they're home attendants, they're restaurant workers, and many of them are single moms. And all of them lost their jobs. Not only are they struggling to make ends meet, including putting food on the table, but they're also still doing so much more of their caretaking for their families. And for many survivors of gender-based violence, lockdown made their life a nightmare, right? In a home that was already not safe. So to meet this need, we've given out close to $30,000 in cash assistance to 45 emergency fund recipients in just the last few months. And we're also providing, emotional support, including legal and housing referrals. And we've also been delivering groceries. And, like Aminta mentioned, we couldn't do this work alone. Coalitions and partnerships have been so vital. In Queens, we formed the Richmond Hill and South Ozone Park COVID Relief Coalition in partnership with several community-based organizations like South Queens Women's March and Chaya CDC to hold food pantries and to address the food insecurity being experienced by so many Indo-Caribbeans and South Asian families. And collectively through the coalition, we've given out food to over 1,000 families. In the Bronx, we partnered with Sapna NYC and the Bharati Foundation to provide food to over 300 Bangladeshi and Indo-Caribbean families. And in addition to our mutual aid work, we've been addressing the anxiety and isolation that so many of our members were experiencing during the shutdown. You know, we began holding weekly virtual healing spaces for our members to connect, to build community, and to receive mental health support. And before, we were just doing this on a monthly basis, but we saw how important that need was for folks who lived alone and didn't have anyone that they could connect with. Having that virtual healing space just meant the world. And we're also part of the Fund Excluded Workers campaign. It's a citywide campaign to advocate for poor and working class people and immigrant communities like ours who've been financially devastated by the pandemic. And through giving groceries and cash assistance, we've been able to make life a little easier for people, but we know that's not enough. Our community needs so much more. So we know that organizations like all of ours here have been doing what we can to fill in the gaps, and will continue to be doing what we need to fill those gaps.
Great. Thank you, Simone. Okay, sorry. I think thank you so much, Simone. And you certainly are, Jahajee Sisters is small, but certainly mighty. And I'm so impressed by the incredible work that you are doing, especially with the Cash Assistance Emergency Fund for Survivors. I know that many of our clients have utilized it, and they would not be able to move on without your support. So thank you so much for the incredible work that you're doing in our communities. And I also, before we move on to the next question, it is also evident listening to you all how much your workload has gone up, but amazed at how seamless you all are making it look. So thank you for sharing the work that you're doing with your communities, all of you. So we are going to be moving on to the second question. How do we effectively engage our respective community members to build community infrastructure and address violence? And I throw the first question onto you, Simone.
Sure. So at Jahajee Sisters, we know that taking trauma-informed approaches is so important. As a people who come from a history of colonialism, from a history of indentureship, who are deeply disenfranchised and marginalized, trauma lives in our bones. That intergenerational trauma has been passed down from generation to generation. And, you know, we have to be mindful of that when we're doing this work. So that is an approach and a methodology that we integrate in everything that we do, from our sister circles to our Leadership and Empowerment Institute, to just the way that we connect with each other within Jahajee Sisters. Because we know to address that trauma, we need to support survivors to heal, to build their inner resilience, and to create a powerful vision for their life as a pathway to creating change. And this is part of the way that we see that we can shift culture in our community, because so much of that trauma is rooted also in just the way that we were taken to the Caribbean as indentured laborers. You know, the violence, gender-based violence in our communities, it's really unique. You know, it stems all the way back to the days of indenture when our people, there was such an imbalance in the number of women who were taken. And so we know that as we address the work now, we have to do it for the generations behind us and before us. A lot of Indigenous people will talk about that when we heal, we're not healing for ourselves right now. We're healing for the 7 generations that came before us, for our ancestors, and we're also healing for the 7 generations that come before us, for our children and our children's children. So we also know that community-based interventions and solutions are incredibly important. Creating a nurturing network of support that can be activated for our base of survivors, so they know that they have a community they can turn to in moments of crisis. As a survivor of gender-based violence myself, I remember how alone I would feel and how isolated I would feel. And having the Jahajee Sisters community is how I found my healing and my support. And so I know how important this community is for our members. And so it's something that we continue to create and cultivate in whatever we do. And survivor agency is another big one. We know that we need to support survivors to be in choice and how and when they seek accountability for the harm that was caused. In this political moment, we have to trust survivors to do what they feel is best. And maybe that means involving law enforcement, and maybe it doesn't mean involving law enforcement. You know, like as undocumented survivors, that can be incredibly dangerous too. So how can we tap into other ways of supporting our survivors to know that they're not alone in this, that they have a community that has their back? The other piece is economic justice, right? One of the barriers to survivors getting out of gender-based violence situations is the fact that they're economically tied to their abuser, right? And that was one of the reasons why we created our emergency fund in the first place. What are the small steps that we can take to empower a survivor to stand on their own feet, right? But even going beyond that, like, what are the roots of this issue? How can we actually support survivors to thrive and to self-determine their own economic future, right? How do we support women who are nannies to cooperatively come together and create a business where they can actually, thrive and not always have to depend on themselves? So the economic justice piece of our work is really important. And so is the grassroots organizing. You know, we're working towards systemic change at the community and the citywide level. And we can't do this alone. We know we have to do this in coalition with so many other organizations that are working for gender justice.
Great. Thank you so much, Simone, for sharing that information, especially regarding trauma-informed approaches, because we're constantly working with victims who are poly victims who've experienced lifelong trauma. So it's so wonderful to hear about how you're working with survivors to heal and focus on the resiliency, strength, and instilling hope. And thank you also for sharing your own experience with us. So now I'd move on to Bidhata from Arab American Family Support Center.
Thank you, Susan, once again. So Arab American Family Support had been established in 1993, I'm sorry. So since 1993, AFC has been providing active services to immigrant community and refugees with the tool they need to successfully accumulate to the world around them and become active participant in their communities. We have 4 priorities, that is prevent, promote, get ready, and communicate. And under the preventive program, we strengthen families, prevent child abuse, and work to end domestic and gender-based violence. Under the promotion program, we promote wellness, family reunification, restorative justice, equity, and fair policies. And we also have a Get Ready program. And Get Ready program, we do prepare families to learn, work, succeed, give back, and lead healthy, productive lives. Under Get Ready program, we also provide citizen preparation classes for citizenship, English classes, and we have a communication department. And through this program, we amplify the voices of the marginalized and under-resourced communities and share our knowledge. So at AFC, our client trust us to share all available options available to them in time of need. We are committed to amplifying their voices and respecting the choices that are right for them, for their families. It is important for us to build this trust with our community so we can effectively advocate for them and meet them where they are at. Our team is culturally and linguistically competent and trauma-informed. Collectively, our advocates speak Arabic, English, Pashto, Punjabi, Urdu, Nepali, Hindi, and many more languages. As an expert in delivering culturally competent services, we also provide cultural competency training to other service providers, agencies, and organizations in an effort to extend our guidance, experience, and lesson to build a safer and healthier city. So through our 4 priorities area, that is prevent, promote, get ready, and communication, we are actively engaging ourselves to community members to build infrastructure to address domestic violence and gender-based violence. Thank you.
Thank you so much, Bidhata, for sharing all the culturally competent services that Arab American Family Support Center provides. We are moving on to Tara from Safe Horizon.
Thanks, Susan. So I really believe that community is so important when it comes to survivors feeling safe. And so I think it's really important that we build upon safe spaces for South Asian survivors to get together and rebuild connections with community. So as case managers with Safe Horizon, we're trained to, when we safety plan, we draw from community, and we ask clients about the people in their lives who have their back. And when we hear that someone has a community and has people who are there for them, we know that they're safe because they have someone they can turn to, they have somewhere they can stay. And we get really worried when people don't have anyone who understands and who can be there for them. That's kind of a red flag for us that shows that we need to do a lot more safety planning. So it kind of this question made me think about a client of mine who was sexually assaulted, and her community completely disowned her. She was completely shunned. And we know that that's not a unique experience for South Asian survivors. So I think it's really important that we have safe spaces such as support groups and community-based interventions where survivors can connect and find safety in one another. And I also think that training for service providers is at community-based organizations is really important, especially when those organizations don't necessarily specifically work with gender-based violence. So I just want to share that, for example, the organization Women for Afghan Women that's located in Eastern Queens, they work with immigrant women and help them with citizenship classes and, basic support groups. And we've actually, at the Family Justice Center, gotten a lot of referrals from them just by them being able to speak with their clients and identify the signs of gender-based violence and their awareness of the resources available, so they know to refer them to us and to speak with their clients about gender-based violence. So it's really important to have that training in community spaces so that people know how to intervene and can spread information that's accurate.
Thank you, Tara, and thank you so much for talking about the trainings. And of course, Women for Afghan Women, we work so closely with them, and we do have a lot of referrals. It's great that we have other partner agencies that work with the various communities. So I appreciate you sharing that. We are moving on to Aminta.
So the question is, how do we engage effectively our respective community members to build out that community infrastructure and to address violence? And so much of this boils down to trust, right? Susan, you mentioned that we've done a lot of work together to raise the visibility of the Family Justice Center and its work in the Indo-Caribbean community, where previously so many community members just didn't know that the Family Justice Center existed, or if they did know, they were nervous to access those resources and services because someone from their community didn't necessarily vouch for those resources. And that linkage is so important because there's an inherent distrust of government and of governmental resources, especially among undocumented immigrants and working class immigrants in our community. So I remember, years ago, and we try to do this on an annual basis, we partnered with the Family Justice Center to do outreach on Liberty Avenue by Lefferts Liberty in Queens. And we were handing out palm cards as far as what it would mean to be an upstander. And we were, walking door to door to businesses and asking them to pledge that they would talk about gender-based violence and resources available. And I remember an elderly auntie just held my hand and she said, look, she talked to me like I was her granddaughter. And she said, I've lived with this abuse for years, and I'm dying now, and I'm going to close my eyes, never knowing what true love actually felt like, because I was like forced into this marriage, and here I am. but can I talk to you? Can I have your phone number? And, you know, there's so much of that where it's like our community members really focus in on the person that has touched their heart and really wants to connect with that person because they find that connection is there. So how do we move from that trust that is built to getting somebody the help that they might need, and what that looks like to do that warm, I guess, warm handoff, for lack of a better term. It takes time and it takes a lot of effort. And many of my family members have been in similar situations. I have been in similar situations where I myself, even being an attorney, was nervous to get an order of protection out against my former abuser because I was worried about what that would ultimately end up looking like, right? Because law enforcement and the criminal justice system may not necessarily be the answer for everybody, can actually sometimes backfire. So, you know, having those nuanced conversations and figuring out what's best for, I have to speak slower. Yeah. So what's best for a particular survivor? In our pandemic, many of our community members have relied on their faith-based institutions for solace and for healing. You can literally, when you're sitting there in satsang, which is sacred gathering for Hindus, you'll see sometimes the tears and the pain of in the eyes of aunties, and, you know, who feel like they have nowhere else to turn, who feel like God is their only solace because there's no way out. But for those who do choose to move forward and take action and go from being victim to survivor, they sometimes reach out to their faith-based leader, who become de facto counselors I'll speak for the Indo-Caribbean community, in the Indo-Caribbean community. And we don't really have community spaces except for these houses of worship. So they function in that way. And these faith leaders are not often equipped with the tools necessary to respond in a trauma-informed way to violence. They aren't equipped. And so how do we provide them with the tools such that they're not perpetuating patriarchy and oppression, which is a real thing in faith-based institutions, right? How do we provide them with those tools to ensure that they're supporting survivors adequately and then connecting them with the resources that they deserve? And what does it also look like to develop community infrastructure, community interventions as a contrast to law enforcement and criminal justice involvement, where this feels safe, right? When we don't have viable alternatives, it can sometimes feel as if going to the police is the only approach. And as a nation, over the course of the last several months, we've had to really grapple with the reality that is police brutality. What does it look like to alternatively develop social service responses? What does it look like to train community members to be first responders? A new model that we're seeing across the country that collectively requires mass mobilization to be implemented, right? For it to work properly. And some of our local community partners are doing this now. And, you know, we have to continue to weave in these conversations wherever we can, whether it's joining a temple Zoom where hundreds of people are gathering to celebrate Navratri, which is a festival of the goddess that just passed, whether it means being stationed at food pantries, because right now for an abuser, this is like their most formidable tool. Isolation is their most formidable tool. And that's what we're seeing now. And we just have to continue to strengthen the ways in which we reach out to community to combat that.
Thank you, Amintha, for sharing that with us, especially how valuable it is to work with faith-based institutions, especially when reaching out to our community. So thank you for sharing that. I want to pass it on to Vidula from Sakhi for South Asian Women.
Thanks, Susan. And Aminta, thank you. You know, I think so much of what you said really resonated with me, and just the sort of work that, you know, we've been doing at Sakhi for the past 30 years. You know, it isn't possible for us to create a world that's free of violence if we don't have community engagement and support. I think we need to come together as communities, and communities must collectively denounce, you know, regressive beliefs, challenge restrictive gender norms. And I think only then we have a chance of working on creating a violence-free world. You know, at Sakhi, we've engaged in connecting with the community through grassroots outreach. We have several doctors, school administrators, youth leaders, beauty therapists, and community and religious leaders who have become our on-the-ground Sakhi champions. These community members have allowed us to reach inaccessible pockets of the community and connected us with those in need and those who don't know that Sakhi exists. we have worked with these leaders and these community allies to present services in socially acceptable forms, because walking in as a domestic violence organization isn't always welcome. So we've had to go in and have tabling events where we show up as organizations that offer ESL or computer literacy classes. And domestic violence continues to be stigmatized, and Sakhi hasn't been able to go in with the anti-gender-based violence lens. Our network of upstander allies are those members, we consider those members who offer support through validation, by reserving judgment, and who know that when a friend or a family member reveals an experience of gender-based violence, what are the resources that they might be able to share with them. Another important focus of our work has been to provide trauma-informed cultural humility training to partner organizations and service providers. I think Tara may have mentioned, organizations that provide services but are not directly involved in gender-based violence work. And it's an essential part of our advocacy efforts. The last thing we want is for us to refer a survivor to an organization and then have them re-traumatized when seeking services. And especially in a virtual setting today, that's even more relevant. Recently, we conducted a multi-day training program for the crime victims advocates that are stationed in NYPD precincts. And the training focused on gender-based violence in the South Asian context. Through the training, victim advocates in NYPD develop understanding of the community, and they can offer the nuanced support that a South Asian survivor needs. And I'll wrap up by talking about reaching those communities that are not in Brooklyn and Queens. For instance, Staten Island. That has been a community that we haven't had as many clients reach out to us from. And so we developed a partnership with Staten Island Legal Services, and we were able to leverage their presence and their geographical expertise to reach underrepresented South Asian neighborhoods in Staten Island. Honestly, just without community buy-in, we'll always be reactive and not transformative the way we really want to be with gender-based violence work. Thank you.
Thank you, Vidula, and especially about the fantastic trainings that Sakhi offers. There's folks out there, I urge you to utilize them for cultural competency trainings. It's really remarkable and it's interactive, and I learned so much from it. So thank you for sharing that. I move on to Navneet from Manavi.
Hi, so as far as community engagement goes, that has been the center of Manavi's work for the past 35 years. Manavi was founded in 1985 and initially predominantly a volunteer and then community member-driven agency. So we recognize that community members are both agents of change and beneficiaries of change, which means it's so important for us as an agency to engage and invest in community organizing and mobilizing to make sure we change as well as challenge the cultural and social norms that ultimately contribute to the violence that we're trying to address. It's also so important that we build trust between the diverse South Asian communities and also create a safe space for community members to be engaged and for leaders to emerge within our community. Also, I think another key piece, which has already been mentioned by other panelists, is building capacity and support for community members and stakeholders to be able to empower them and engage them. So just to give examples at Manavi, how we've done that, Manavi has a 24-hour hotline and has had the hotline for many, many years. And that hotline is exclusively staffed by trained volunteers from our community. We invested in community members over the years where they all got DVRT training, they attended various training sessions, and we've had the same consistent, this is something that touches me as an individual and as a South Asian woman as well, to see that we've had the same community members who predate me, have been involved at a community engagement level, but stepped up. So we've had community members who stepped up to be active volunteers, and our 24-hour hotline is staffed by them where they all speak a whole range of South Asian languages. And I'm so very grateful to them. Similarly, in Ashiana, which I mentioned earlier, our transitional home, In 1997, when it was founded, it was exclusively supported by volunteers. Over a period of time, we built stronger infrastructures, and although today it's funded by both grant and funding, each week our volunteers are the ones who do groceries and do culturally specific groceries, and they tailor it to each individual resident's needs based on their faith, based on their dietary needs. So each week there's a customized culturally specific grocery list where our community members who are volunteers and trained do it, and they've been doing that for many, many years. I'll just wrap up by saying that the other piece that's really been important for us is engaging men as allies. That is something that we have delved into doing more deeply now in more recent years, because we understand that community engagement and prevention are connected. So we have begun to engage men as allies in the community. We actually sought and got funding to do that work, because most of us know funding is an issue. So that work has been funded, and we have been conducting a community needs assessment and focus groups specifically on trying to engage men in the community so we can address the deep-rooted patriarchy that we see in the South Asian community.
That's great. Thank you so much, Navneet. That sounds great. I'm so impressed that you're able to sustain this incredible volunteer network of committed folks. And I hope you're able to publish the results of the study. So thank you so much for sharing that information. So before we move on to the next question, I'm so glad that we're able to hear about all the work that you are doing on a grassroots level within the community and the outreach that is done to marginalized communities. So now we are going to move on to our final question. As we work to create safer and healthier communities, how can we build a more inclusive movement? And the first question goes to Tara.
Sure. So it's really key for us to center marginalized South Asian folks in any movement that we are a part of and starting. So that includes undocumented folks, Muslim folks, Dalit folks, queer and trans folks. And this doesn't mean, thinking about the mainstream movement and thinking about how can we invite those folks in. I think it's more about how do we adjust the movement to meet the most pressing needs of our community, our communities. So yes, it's really about kind of adapting and changing to really meet the needs of marginalized folks. So I think we do this in part by seeking truth as advocates about the various systems that exist in our communities that perpetuate violence. So that includes Hindutva and the caste system and cis heteropatriarchy and other systems as well. And we need to recognize that these systems need to be addressed and can be addressed as a means to address violence against women and trans folk. So gender-based violence does not occur in a vacuum. It influences, and it's influenced by all these systems at play. And just to give a few examples, right? A lot of us, I think, know about the Hathras case that occurred in September, where a Dalit woman was murdered after she made rape allegations against upper caste people. And a lot of Dalit people have come forward since then and spoken about the violence that their community faces. So that's just tying into how gender-based violence and caste violence is so connected. And we really need to bring caste violence to the center of our movement. And this is true as well for trans folks as well, who face insurmountable amounts of violence in every community. And our communities are no exception. So we really need to bring trans folks to the center of our movements as well.
Great.
Yes, thank you.
Thank you, Tara. So in looking at the time, we're 10 minutes and we want to be mindful of time. So we're going to move on to the next panelist, Bidhata. Bidhata, you there? Okay.
Sorry, I was mute. So thank you, Susan, one more time, and thank you to all the panelists to presenting your ideas on this, special issues, domestic violence and gender-based violence. So I think how we can build a more inclusive movement. As you guys all discussed, that one of the key thing to do is to foster a partnership, build a collaboration, and shared resources and information. And I don't disagree on that. I completely agree that we need partnership, collaboration, and shared resources and information. On only in that basis we can create a safer and healthier communities. Aside from that thing, I would also like to add that we also need to understand the cultural context of the survivors, because as a South Asian, I belong to the South Asian community, and so I believe that every culture has a different way of taking a domestic violence. Some do take, some has a some domestic violence has taken narrowly in some cultural context, and in other contexts it has taken strictly, and some other context it has taken as normal. Based on my experience working with my client, I would say that some of my clients says that like beating to the wife is taken in their culture as normal as nothing. So they think like beating a wife is disciplining a wife, which I don't agree. It's completely wrong. So we also have to understand the cultural context of our survivor to engage effectively to the community. And I would like to give one example. Like it's not example, but it's my experience working with my client. So she is from different culture, and she speaks different language. So our agency has provided her the family, like to support her family. Our agency has provided her family therapy. So under that program, the social worker from our agency has to visit her home every week or every bi-weekly, sometime in a month. So that's how it has been going. So so what happened while providing a family therapy, visiting her home, she refused to have a male social worker. Then she talked to us, and she requested to change a female social worker. So what I'm trying to say here is that for some culture, probably having a male social worker is okay, but some for some other social culture, the client sometimes specifically request like special kind of services. So we do take that request into special consideration, and we change male social worker from female social worker. So so we have to understand the cultural context as well.
Yes, thank you so much. I'm sorry, we want to get to the other speakers. Thank you so much for sharing that. Aminta.
Yep. So, yeah, Tara, I'm really glad that you brought up Hindutva and casteism and how that plays into violence. I'll also say that as a Hindu, I wish that Hindus did more organizing with Muslims. And so much of that dates back to, Hindu nationalism and issues that I wasn't necessarily exposed to as an Indo-Caribbean until being a co-founder of Sadhana, which is another organization that I've been a part of. But I'm really glad that you underscored everything that you did. And Bidhata, you talked about beating wives being normal. In Indo-Caribbean culture, it's if he doesn't beat you, he doesn't love you. which is not the way we should be thinking, right? But so South Queens Women's March is organized intersectionally, and we do that across generations. We do that across different identities, orientations, and across different races. Our leadership and membership is reflective of the diversity of South Queens, includes Indo-Caribbean, South Asians, Black, Latinx people. Before South Queens Women's March, we were organizing in silos, and today we're a movement together, learning and growing together. Prior to that, oftentimes Indo-Caribbean people don't organize with Black people. And a big part of that stemmed from a colonial history and a trauma that Simone talked about earlier, so I won't get into it. But what we're building out together is what we believe to be true solidarity to address the issues that affect all of our communities. I want to talk a little bit about mental health. So accessing mental health resources, oftentimes I've heard this in our community, that it's something that white people do. And it's not something that necessarily we avail ourselves of. We'll go to, and I'm generalizing, of course, but we'll be more likely to go to a medical doctor, but we don't access mental health services. Often that doesn't happen until there's a hospitalization of an individual due to violence, and then there's a requirement to access mental health services once upon discharge. And then, so that's a problem, right? And how do we leverage existing mental health resources, which have become become even more limited during the pandemic as people move to doing video counseling, which can be daunting for somebody who's accessing mental health services for the first time and is now meeting with a stranger to discuss their trauma. So we're having to grapple with all of this. People who are now in domestic violence shelters, what happens when they time out from their limited duration that they're allowed to be in shelters? How do we extend that such that they're not timing out and going into general population shelters that are dangerous, especially now during COVID, at the risk of infection where they're densely populated? And in these shelters, how are we treating trans folks? How are we treating our LGBT community? Where do they go? And I know this is unpopular, but what about men, right? So how are we mobilizing men to be agents of change? People, disproportionately men are perpetrators and women are victims. 7 attempts usually to leave your perpetrator. What are we doing when men are mandated to do courses through the court system? What does the batterers intervention program look like? Are these courses meaningful, or are they just a check off the box where a perpetrator can say, yes, I did that, now I'm gonna move on to continuing to abuse my partner? And also, how are we centering the voices of those who are incredibly marginalized, our LGBTQIA population, those who are dealing with HIV, people who are now sheltering at home, not just with their intimate partners, but are suffering from homophobic, biphobic, transphobic roommates, family members, friends, neighbors, and how are we grappling with all of this to really pave the way for an inclusive movement? I know I have to wrap up, so I won't continue. But I'm just grateful for this platform. Thank you so much, Susan and everyone.
Thank you so much, Aminta. I really appreciate it. Now we're going to move on to Vidula.
Thank you. I know we're really short on time, and so I'm just going to acknowledge, thank you to the panelists for bringing up a lot of the issues that I was going to talk about, which is, who are we leaving out of this movement? Who is lurking in the shadows? Who is not reporting issues of gender-based violence? And so I think for me, talking about, I wanted to, and I'm going to keep it super brief, but to talk about males for sure, I think we, as a society, we have to understand that domestic violence is affected by gender, but it isn't gendered by itself. And so are we making space for cisgender heterosexual males who are typically viewed as perpetrators? Are we making place for transgender folks within conversations that we have in the communities? And I want to point out youth, right? Children who've witnessed domestic violence are primary survivors, and our youth program believed in that, and that was the genesis of the youth program. I guess, yeah, I'm keeping it super brief, so yeah, let's go.
Thank you, Vidula. Navneet?
So basically, just to reiterate a lot of what the panelists have already said, survivor-driven and trauma-informed advocacy focused on safety should always be and is the center of all our work. We've already talked about taking the intersectional approach, which is key to our work to serve marginalized and communities of color. I also want to highlight in terms of immigrant survivors to be really, really mindful, and this is something I think was mentioned earlier, for immigrant survivors where there is a power dynamic where their immigration status is dependent very often on their abuser. and the abuser uses that power dynamic as a tactic to ensure that they don't report the abuse because they're afraid of deportation and these threats. And I think this is where law enforcement play an absolute crucial and fundamental role. We are very thankful for the work law enforcement do every day. And I think this is the time to actually, for all of us, to build those stronger alliances and partnerships with agencies. And it's mutual. We need to have mutual trust. We need to have mutual respect. We do see that in communities of color, sometimes due to that fear or distrust, the access to services and resources are impacted. And just to give a quick example of how in New Jersey, the New Jersey State Police had invited Manavi along with other agencies to be part of an advisory board where we actually sat at the table, which is so key for agencies like ours, to give input to draft a curriculum for police training across the state in New Jersey. And this was a process that took months. And ultimately, we were able to give input based on what was important for what issues and what cultural nuances law enforcement need to think about. Language access is one, immigration status is one, and there are a whole range of issues. And we felt that having that partnership was key, because where there were perhaps gaps in understanding and not fully being aware of what the needs of the community are, that's an area where agencies like ours can build partnerships. And it really worked well for us here in New Jersey. I will wrap up there because I know we need to get to
Thank
others.
you so much, Navneet. And we are moving on to Simone.
Hey, everyone. Okay, I will close us out quickly. So I just want to say that as we work to create safer and healthier communities, we cannot do this work in silos. We must be intentional about building solidarity, right? A multiracial and cross-class coalition where those with more privilege are committed to building deep, meaningful solidarity with those who have the least privilege is critical for achieving gender justice. And we need to center those who are most impacted by gender-based violence and state-sanctioned violence in this country. Yes, the Indo-Caribbean community is a historically marginalized and disenfranchised immigrant community, but there's no way my people are going to get free unless we all get free. Our liberation as Indo-Caribbean and South Asian people are inherently linked to those who are even more marginalized and disenfranchised in this country. And that's Black and Indigenous people, that's Black trans women. So let's follow their lead in this fight for gender justice, right? And I just want to close by saying we're in a movement moment where we need to be coming together more as gender justice leaders. This panel is such an important step in that direction. We need to be collectively innovating, experimenting, and practicing, what alternative, an example of that is exploring what alternative models involving law enforcement could look like when supporting survivors of gender-based violence. So let's just come together more and build and connect and organize together.
Thank you so much, Simone. And thank you all for sharing. Always interested to hear how dynamic the work is, and the organizations have been pivoting. It is also evident now more than ever during the pandemic how collaborative work and building our allies are so crucial. And we thank each and every one of you for the incredible, extraordinary panelists. And I hope we are able to continue these valuable conversations. And I turn it over quickly to Kavitha to say a few words before we wrap up. Kavitha?
Hi, sorry. I just realized I was on mute. Thank you all for joining us today. And once again, a special thanks to the First Lady of New York City, Grace Choi, Commissioner Cecile Noel, Jennifer DeCarli, the Mayor's Office to End Domestic and Gender-Based Violence, the Queens Family Justice Center, and all of our incredible panelists for being here in this space and for being part of the larger movement toward gender justice. To those of you who showed up today, please note that the deck will be sent out shortly, and we are grateful for your participation.
Thank you, everyone. Have a wonderful day. Thank you for joining us.
Thank you.
Thank you.
Thank you.
Thank you, everyone.
Thank you.
Thank you, everyone.
Bye, everyone.
Bye.
Bye.